Hello, everybody, and thank you again for joining us on this episode of the Eckhart and Coca Report. We're very happy to have with us Dr. Leonardo Valentin, who's a physician. He's a radiologist, both a diagnostic radiologist and an interventional radiologist. But he's also running for Congress in District 7 in Florida. And so we have Leo here to talk about a number of things, including what's going on in Florida related to COVID and all that. But Leo, welcome to the show and tell us a little bit about yourself.
Well, thank you very much for having me. I'm a big fan of the show, and so is my brother, so he sends his regards. I'm an interventional and diagnostic radiologist, so board certified on that specialty. I grew up in Puerto Rico. I come from a medical background. My grandfather was a Korean War veteran who became a physician. My father's a vascular surgeon, and I pursued vascular and interventional radiology. I did my training in several places, including New York Presbyterian, Cornell Hospital. I did residency at Baylor Houston, and then I did my fellowship at Mass General. So I've seen different models of healthcare, different philosophies, and I've been able to learn a little bit from that. I also worked in Silicon Valley with NVIDIA Corporation. And so I should have mentioned I did undergrad in University of Miami, so I did computer science there. And that's how you sort of put everything together.
Okay, great. So how are things? First of all, what's happening in Florida today or these days?
So today we're talking about phase 2. As you know, we had already begun phase 1 in terms of relaxing some of the restrictions. We're obviously monitoring the data and seeing what's happening. But to get a big picture of things, we should realize that Florida from the early on it did things a little bit different, and here on the ground we could sense that the approach was being what we call a tailored approach, and that's something that, as you probably saw the media, some people wanted more of a central guidance either from the state or from the federal government. But I think people here were very happy seeing that tailored approach based on number of cases, and like the governor has said, the data-driven approach. And so it's not only saying it, but actually using that data to adapt your approach and your recommendations for different parts of Florida. As you guys will recognize, it's very different, Miami from Jacksonville, for example.
Right. And so in effect right now, so what are the restrictions and how are they differently in different regions?
Sure. So there were 2 counties that were sort of the denser population with higher cases that were treated differently. For my case, I'm Seminole County and Orange County. And so the restrictions have varied now. And in phase 1, we've had access to restaurants, for example, and that capacity, trying to encourage outdoor seating and things like that. Now with phase 2, what's going to happen, we're going to move that percentage up to 75% occupancy rate for restaurants. So that's the biggest change. Then other establishments are going to be able to open and so on. So, depending on who you ask, and I think that's part of what has happened at the national level. I think the definitions for different people mean different things, but we had this guidance from the governor, and then every county adapted to that. So, some people might call that a lockdown or not, but there were that general guidance that I think that's a general order that people can sometimes consider as a lockdown. And then you have the curfews at the county level, and those varied by county to the extent that sometimes you have to take a look to make sure if you're moving around counties that you're complying with the different curfews, for example.
Mm-hmm. Are you saying that the DeSantis model worked because it was more decentralized, or did he? I mean, what would you specifically characterize as different in terms of what he did?
Well, I mean, I think we're still early, right? I think we recognize that that we have been, you know, uh, in a way. So the numbers are reflecting a trend that we feel confident for starting to open things. At the same time, we have to be humble that we're monitoring this, and you have to adapt to the data. So for me, early on, one of the things that sort of made sense, and I think it's part of the success, is the what was created as the special teams for nursing homes. So having that focus early on the vulnerable population, I think that was a great decision by the governor. We recognize also there are other factors, right, that might be more regional factors like the density, perhaps climate, and things like that. So we need to constantly reassess. And like I was telling Michelle, I think it's important for us to recognize and not try to predict necessarily too early, what was done well and what isn't. Obviously we need to make decisions in the face of uncertainty, but at the same time, we know as we open and we expand testing, there are going to be more numbers coming out, and in terms of the science too, we're going to understand some of the implications for that. But I definitely think the being able to tailor the response, I think that's important, and being able to also create these special teams. I think they're called the REST team, so it's like a rapid response type of team, and it sort of brought analogies to me. I don't know if you guys have heard about the MASH units. My training at Baylor, Dr. DeBakey was known for in the military establishing what was the mobile ambulatory surgical units. And that was the whole idea, was to, bringing surgical capabilities closer to the front lines. And so I saw some analogy to that when the governor was describing the teams that were going into either long-term care facilities or nursing homes and deploying either PPE testing and things like that. So based on that analogy, I think it made a lot of sense to do that.
So the numbers now, I mean, it's been, the restrictions have been relaxed for 2 weeks or even more, perhaps?
Yeah, so since the start of May, the restrictions, we enter what was phase 1. And so that started. Obviously, numbers were being monitored, and there were some questions in terms of when can barbershops, for example, open, bars and other establishments, right? So there were a series of meetings, and the governor came to Orange County, met with the mayor locally. So it was, I think it was the decision making wasn't necessarily easy, but it's been part of this ongoing conversation, obviously looking at the numbers and making the decisions.
I imagine you're in virtual contact with a lot of people, these days with your campaign and things like that. How are people reacting? Are people generally happy with the fact that with the course that has been taken, or is there a fear that among some people that this will get out of hand? And what is your sense?
I think for the most part, I would say the vast majority of people are happy with what has been done. I think obviously at some point, South Florida, there was some concern, and so, but at least locally, what you can see is people are there's obviously a lot of fear, and sometimes I thought there was a disconnect between what the media was saying and what we're seeing here on the ground, and so you wonder, maybe the media is capturing what's happening in Miami, right, and not the rest of Florida, and so I remember the analogy of the beaches being open, but the subway in New York was open, but no one was talking about that, right? It was really focused in Florida, and that's where I sort of see the political implications of this, and you have to recognize it's you're in an election cycle and things like that, so you have to balance all those factors and try to gather and synthesize information, which is what I think it has been so difficult about this, right? That everyone has a different perspective. Some people might have a different agenda. Expertise can be very narrow, right? So we can be talking a very, very specific point, but they're missing other components of the situation. So every time I'm looking at that, I'm thinking about all those things.
Tell me, before we continue about Florida, I assume you're in touch also with what's happening in Puerto Rico. And what's the situation there? How are they approaching it?
So I have family. I have family in Puerto Rico, and also in the healthcare system, and so it was interesting because I was telling people we went out to a restaurant, and again here in Central Florida that we were doing that for several days now, or several weeks. And then there was a shock factor from people in Puerto Rico because they're not allowed to go to restaurants, even in outdoor sitting. And so it's been different. There's so many factors that I think have been different. I think the governor there reacted early and did a shutdown. I think most people recognize that the healthcare system in Puerto Rico doesn't have the capacity in comparison to most states. So they have to be extra cautious for that. But again, I think also the political component has been there, and sometimes you have experts with very strong opinions about PCR is the way to go, rapid test is the way to go, or serological testing, and I guess it's the same thing that we've seen at the national level. But it's just there's the added concern that obviously supplies and testing tend to take a little bit longer to get there.
Mm-hmm. It's also a poorer state, quite a bit poorer, and therefore the effect of the lockdowns must be felt even more strongly, I imagine. Yeah. It's very difficult.
I was actually
go ahead.
I was actually talking to some physicians there, surgeons and other specialties, and I guess you guys being cardiologists, you appreciate this, but we're seeing patients apparently with more transmural infarctions because they're waiting longer to get to the hospital. They're calling patient back for aortic stenosis patients, are calling them, and unfortunately, a recent case, the patient had died in the previous week. So there's definitely an effect, and I'm when I mentioned this, New England Journal of Medicine, the article on non-COVID patients suffering from some of the policies is something that we have to keep in mind. I was reading about the trials not being available, obviously cardiac patients and so on. So you wonder how much of that we're going to be seeing later on.
Yeah, it's interesting because we, at least right now, I don't know if you're talking about these things happening in Puerto Rico, right?
Correct.
Right, which seem to be less, at least I don't know, we haven't heard that much about it here, at least not in California. But it brings up a point of disconnection between, again, the economy and healthcare and socioeconomic factors and healthcare, and as a potential congressman and whatnot, and how do you make that connection, or you try to make that connection or not make that connection? My point being, just a couple of days ago, Anthony Fauci, and repeatedly in the last few weeks, he kept saying, all I do is I comment on the public health aspects of things, and I do not comment or do not make recommendations about, economic issues, and right. Trying to separate those things sort of in a crisp manner.
So for me, that was very surprising, right? Because we all study public health, and it's part of our practice. Obviously, you have people that dedicate their lives to that. But I think most of us as physicians will recognize that socioeconomic factor is an important indicator of public health. So when you're saying you're not assessing the implications of how our policies can affect the economy, I think we're missing a big point, not only from the strictly what people will define strictly economic, but also from the public health aspect. So for me, that's obviously concerning, and it makes me think. I've seen this happen with models. I mean, I work with artificial intelligence, and I can't avoid seeing the similarities in terms of you would see the hype about, oh, we're going to be able to look and diagnose lung nodules on a CAT scan. Well, that might be true, but what about other pathology that you're supposed to catch in the chest CT scan? And I've seen a lot of models and even a lot of experts behave that way, right? I'm not worried about X, Y, or Z. I'm just worried about this. And in my mind, I started thinking about all the simultaneous graphs that we have, right? And the best example I can think of is the flat and the curve analogy, right? We all had this obviously it's an analogy, so we're trying to make things simple and make sure we can explain it to everyone about what we're trying to accomplish here. And some people might say, because that's I think another conversation, whether we're shifting the goal here, goalpost shifting and what we're trying to accomplish. But even if we avoid that discussion for a minute, if you think about it, in that graph, the healthcare capacity was a straight line, right? Mm-hmm. You guys remember that? And so when I see that, now we realize, is that really a straight line, or is that also a curve? So the longer you wait, your line is going to be going down, and that's what's happening. So this analogy that presumably drove that much public health policy, it's also severely flawed. And so we have to be cognizant of that and realize that our healthcare capacity is diminishing in some extent.
Right, it's diminishing now. Although, and at the same time, there was the ability to actually raise the, when they made the models, I don't know where they set the line, but there's also, that line can move up and down, fairly quickly, because at first when they stopped all elective surgeries and whatnot, all of a sudden the capacity to have ICU beds and whatnot increased dramatically. So you're right; these things are very dynamic, very they change all the time, and but the main thing is that it's so integrated. I mean, all these different aspects of life and life in society are so integrated that to separate them and say we're going to focus on these, this thing versus that thing, it's fraught with difficulties, which at the same time must be very challenging for a politician or somebody who wants to to be elected to convey a message that reflects that that at the same time you want to appear that you're going to do things right, but you don't want to favor certain things versus other things. I mean, that must be really extremely difficult. So I'm glad I'm not running for office. How are the campaigns being distinguished among and how is that because the campaign had began before the COVID thing, I imagine, right? I mean,
sure. Yep.
And so is this now, has it taken a sort of front seat in terms of I mean, is it the major issue that you and your opponents are talking about in terms of how are you going to address the problem? I mean, is it occupying so much the attention of people that
Yeah, I think so. I mean, I think both directly and indirectly. Obviously, being a physician, for me, healthcare was always one of the top issues I cared about, and I think because it represented some of what we call the fundamental problems or the institutional problems, right. I guess I don't know if you, Michelle, will like this term, but the system-based problems, right? That's a more common terminology that's used now in medical school, but. I always recognize that as sort of the big piece that we have to deal with in order to have a more effective healthcare system. Now, this is just bringing it a little bit more to the forefront and obviously more acutely. So we want to be able to handle this crisis, and at the same time, how do we prepare so this doesn't happen again? So it's obviously in everyone's mind, and I think it made it more relevant, but. It was always relevant, I would say.
So how do you distinguish your approach compared to your opponents? What is it that what are the salient Valentin talking points?
Well, I mean, in terms of my campaign, I have three things that I talk about. So, individual liberty is the first thing I mentioned of what we're trying to accomplish. Number two is we're trying to fight this collectivist mentality. And by collectivism, I'm including the big government central planners, and I'm also including the socialists, which we've had a few, and we saw it in the some of the presidential candidates from the Democrat side. And number three is about the level playing field, right? We want to make sure that Americans have, or our children have, the same, if not better, opportunities than what we have. So if you take those principles, and I think in healthcare we've seen that. So you see government intervention in healthcare created this uneven playing field. You have what we call the original sin of healthcare and tying insurance to your employer, and you start realizing all these pieces are so ingrained in our system, and even price fixing. So I was reviewing the South Korea healthcare model, and one thing that was really striking for me is that they do not have price fixing. When you go to Medicare and Medicaid, that seems to be part of the problem, and you start making all these arbitrary decisions that for some procedures it might be fine and you might be accurate, but in some other procedures, that decision is not really representative. And I'll tell you from experience, this is more at the insurance level, but you could see in interventional radiology, we do a lot of different procedures, right? And different specialties might have 2 or 3 procedures. For us, is a plethora of procedures, and sometimes some insurance companies don't do necessarily the analysis for all those procedures, cost analysis, and they just establish some fee arbitrarily, and they just copy paste all the way down in a column, and that's how they made the decision. And the problem with that is sometimes they're going to get it wrong. And I think even for testing and bringing it to COVID-19, I saw some prices and people were asking questions: is this the price for the test, or is that includes a PPE? And so when you make things very arbitrary and price fixing by a central planner, then you create problems that then have consequences later on.
Mm-hmm. Yeah, it's for sure, including shortages, and we've seen a lot of that, with this pandemic. Tell us about what's happening for you in your campaign in the next, few weeks, few months, or what's.
Sure. So we moved to a digital campaign. So we had a couple town halls that were digital town halls. We're actually doing an event, a Zoom event, which seems to be the most popular platform now. And so we're using all these tools to communicate and to answer questions and to be able to have this conversation with the community. I think now that we're relaxing some restrictions, we'll have more opportunities. But again, safety is our main concern, and making sure we can convey that message. So I think we're fortunate to be living in a time where we can have an opportunity to talk remotely, and video conferencing has become a really important tool of that. So that's how we have been adapting really and shifting that approach.
Are you in conversation with physicians in your district?
Mm-hmm. Yeah, I mean, I think the nature of radiology also, we're a fairly large group of teleradiology, and so we're seeing patients in different facilities, and some of the first patients in terms of COVID-19 with the chest CTs, we're seeing that, and the travel history, which a lot of them had. And so you talk to them. Obviously, there are different specialties sometimes, and everyone's adapting a little bit differently. For example, dentists, I've had a lot of friends in New York, and I did my training there. Plus, I have extended family in New York, and so seeing the differences on how as things were unfolding, right? And you compare, I think for the for the most part, most specialties are going to be able to resume their procedures, and that brings me to a point about elective surgery. So in definitions, I think in people's mind, elective surgery, a lot of people were thinking about plastic surgery and other procedures, and we forget that cancer surgery can be quote unquote elective surgery, and so fortunately we're able to resume elective surgery here in Florida, and seeing all that process coming back to some degree of normality.
Mm-hmm. But in terms of your campaign, regardless of COVID, and you're reaching out to physicians, are they more market friendly, or do you find the physician community in your area to be looking for somebody who's going to be more market friendly and try to, I don't know if, as I guess you're running for congressman, so there'd be federal issues, so you might eventually have a say in on Medicare legislations or Medicaid legislations and things like that.
Yeah, I think so. I think our excuse me, our district, we have a lot of independent practices, and so people, it might be the cycle, it might be everything that's happening. I think we have also a more vocal community in terms of direct primary care, which is something I talk about, and we have some recent conferences here. So I see that representation here, and when you compare in terms of direct primary care regulation at the state level, Florida is pretty much at the forefront of that. So it creates a healthy environment for people to promote that independence for physicians. So
Mm-hmm.
so I do notice there's a difference, obviously in comparison to the Northeast, but even at the Northeast, you'd be surprised. I think there's this awakening of sorts of people realizing some of the problems that are happening for a long time, but now they're just become a lot more obvious.
Right.
Well,
Well,
do you think the conservative movement has it has a cogent direction or a cogent plan, if you will, when it comes to healthcare?
I think so, and I would point to the Republican study committee, the RSC document. I think that it's about 60 pages, but very thorough, and I really liked what I saw there. And I mean, that's not the only plan. I think in the direct primary care community, we've seen some other efforts, but they even when they were done separately, you can see they're aligning in a lot of issues, and whether that's the health savings account and how we make to increase those limits. Again, we're talking about arbitrary either price fixing or limits and things like that, all these things that don't necessarily come from any specific analysis. And we've seen how that could be one factor where the patient gets to decide and they manage that budget. So that's just an example. But the RSC plan, I think, is a very good one. And but I'll say also, it's someone mentioned the analogy, which I thought was very, very interesting, is when we look at what Obamacare was and what it did to prices and how they increase, and someone told me, well, when you see a fire, what's the first thing you do? You put out that fire. And so there's something to be said about that in terms of government intervention, that sometimes the part of the solution is removing that government intervention, right? We want to fine tune some things and make sure we do other things. But sometimes the worst part is having that excessive level of intervention that has compounding effects. So, but I do think that document, I'll highly recommend it to some of the audience, because it's a very, very comprehensive document. Because
I get the sense that for the conservative movement, for Republicans, that doctors, they prioritize, at least the larger party, not necessarily, folks like you that are physicians that are in the movement, but the larger base seems to see healthcare as this problem that they have to kind of take care of so that they can do the real work, right? So to them, healthcare is a problem because it eats up such a large percentage of expenses. And so I see all the time that, fairly, influential conservative thinkers are totally okay with price controls when it comes to healthcare. So when it comes to healthcare, the free market, they're not so excited about. And so it's tough to get traction, I think, in the larger Republican movement, because what we're all for is for transparency and competition and prices up front. Yeah. But when you actually get to start applying that, it becomes challenging because you run into these buzzsaws and these buzzwords of, surprise billing and these are complicated concepts for lay people to understand, and it's very easy to tar doctors along with hospitals and other kind of players that may not be may not have maybe more rent seekers than actual giving value. Everyone kind of gets put into this ball together, and then you suddenly end up with a price control plan. So I don't know, it seems like that's why it's so important for folks like you who are physicians and understand that the free market can exist within healthcare. I think folks that are outside of healthcare see it as this thing that the free market applies everywhere but here. But that's why we need Michelle to run.
Yeah,
in San Francisco.
That's why I'm for price fixing. I think the government should set the prices and make them as low as possible, and force doctors out of the system. That's really the only way. So that people like you are not still stuck in the
right.
So
has the Republican Party been fairly supportive of you?
Yeah, we've seen that support, and I think that's why I commend the DPC movement so much, because like you were saying, it's a complex subject, and sometimes people that are not involved directly with healthcare, it might be hard for them to really understand, is it possible, right? Because we've been like this for so many years that some people don't even think it's possible, and then they see a successful direct primary care practice and patients that are really happy that they don't have to be with their doctors for 5 minutes or 10 minutes. And so it's a great example, as how our English teacher used to tell us, show me, don't tell me. So that's what I see the role for a lot of this DPC sort of advocacy and examples. So we've seen that. Yeah.
How would you encourage other physicians to get involved? Does it make sense for what would your advice be to physicians that are in the deepest of blue states, like poor Michelle in California? Like, what should he do? Is there any point to him even engaging in politics, or should he throw darts from his podcast?
Well, I mean, we saw what happened, the other day. So Mike Garcia, flipping a district, and so I see a role, even as I have some family in education and teachers, and as physicians, we're educators at heart. And I think that's an important role for someone that gets into politics, right? You have to be able to not only have great ideas, but explain them. And it's part of this process. And I think, as we have all seen in the recent years, conventional wisdom and politics is also being shattered. So I think there's definitely a role, and I will support you, Michelle. If you decide to run, you can count on my endorsement.
Great.
So the other thing I wanted to mention is, part of why I think I've it's in a way an advantage that I've had is in Puerto Rico, a lot of these concepts were tried, right? So we've had universal, quote unquote, right, universal healthcare. And when you look at the reality of what happened, it was actually my grandfather was already a physician, and the government decides to implement the government plan, right? In Spanish, reforma, and actually, they're reforming the universal healthcare plan. They did it multiple times, so I don't know what iteration they are. But what happened is, once they moved to that, my grandfather lost his contract because he was not part of the political establishment. So they would pick and choose winners of who gets the contract and who's going to be able to be a physician for. So a small town physician now was effectively left out of that new market that they created. So I've seen at firsthand the effects of that. And so it is a problem even today. Essentially, everyone has the card. You technically have insurance, but you don't have healthcare because the card is, and so they sold all the public hospital. Think about the county hospital, everything got sold to finance this insurance plan. So now the insurance plan is essentially it's not solvent, and they don't have the hospital, and they don't have the ability to cover the services. So it's now there's a big problem, and it always gets fixed. Like the Medicare formula was being fixed for so many years at the federal level. So we're having a similar problem like that. And so I think a lot about this because, county hospitals, I did my training in a county hospital, and you can see that although you probably would do some things different in private enterprise, or you can have some criticism about the bureaucracy, the value they have is that the bureaucrat that wants to buy surgical supplies, he has to go out to the market and buy the surgical supplies, right? Now, when you're making it a universal healthcare plan paid by the government, well, they don't go and buy the surgical supplies. They say, well, I'm going to pay this amount of money for surgical supplies, regardless of what's the value in the market. So if that value is wrong, goes back to my previous comment, then you break the system. So in a way, that's a long-winded way of saying you need some skin in the game. And so even the bureaucrat, when he's closer to that market, is going to be able to act more efficiently.
Yeah.
Interesting. What do you think, Leo, of being are you a first generation immigrant, Leo? Is that right? You were. So
I mean, I'm a third generation American, but I'm the first one of my family to sort of live out of the island of Puerto Rico.
Okay.
So Puerto Rico being different, but you know, depending on how you see it, the mainland. I'm the first one living in the mainland.
Do you find most folks to be are most Puerto Ricans who live in the mainland, are they of one particular political ideology or the other, or?
I would say it's really regional. So we have, I should clarify. So my mom was born in New York, and so from that side of the family, we have that's how we have family in New York. But so in Central Florida, we have people, Hispanics of Puerto Rican heritage that move to Central Florida, and if they come to New York, they'll tend to come with a Democratic Party tendency. More recently, we've seen a lot of migration or movement from Puerto Rico to Central Florida, and they come more as independents and Republicans as well. So I think this might be almost at a national level, and it goes back to your question. You know, some people go into a big city and there's a predominant philosophy, and so they learn that. The difference I see for Puerto Ricans coming from the island, it's a little bit of a different system. So the party system there is based on the status question. So either you're pro-statehood, pro-Commonwealth, or pro-independence. And so they come here, and it takes some time for them to sometimes make that conscious decision whether they fit more with the Republican Party or the Democratic Party.
Interesting.
So we're I mean, District 7 is the swing district. We're in a swing state, swing district, and we have a large percentage of independents. So it is that district that it's really important for you to get your message across, because people are listening and people are making decisions, and these might be decisions that are going to affect the state, not only the district or Central Florida, but the state at the general level, and even the country, right, for the presidential election.
Fascinating. Yeah.
Great. So the election is in November, scheduled to take place in person, not by email, or?
It's right. That's we have the primary actually in August, so we'll start seeing how things adapt. I said in a recent interview is we're trying to get things back to normal, but we know it's going to be unprecedented at so many levels, right? Your way of campaigning, voting, and things like that. So we all need to adapt.
Okay, so a primary in August, and then if you cinch that primary, then you go on to the November election.
Correct.
Right. Very good.
Has President Trump made up his mind yet? Who he's going to endorse? Do you have any inside lines?
Not yet. But I'll make sure I keep you guys posted, and we announce it here first. But but yeah, no, we're working hard to earn that support, obviously, both from the leaders of the party and the community. And no one, it is a challenge, and we're up for it.
Is the president popular in your district or among Republicans or in Florida generally?
Yeah, he is, and I would say President Trump and Ron DeSantis are among the most popular figures here. So that's why I say sometimes when I was seeing the media and some of the reports about how things were, you almost felt like people were betting against us, right? And so we're all being very cautious, excited that things are going well, and so, but he's been working really hard, and so. You look at the numbers and you look at the plan, and you can tell there's a lot of work behind it, and it's it's the invisible enemy, right? So we're trying to do our best.
Excellent.
If it pans out well, which we certainly hope it does for Florida, and we see that it was the right strategy and his work with the nursing homes was very good. Then I think in a few months there'll be a very great electoral importance. What happens to Florida? I mean, I think we all eyes are going to be on your state.
Yeah, absolutely. And that, I mean, that's at a level that I can't even explain, because even now with what happened, when you look back at a lot of the America First policies and the reason for or even the travel bans, and people are seeing that these things made sense, right? So America First policy in terms of healthcare, everyone recognizes that. I mean, we've been, I think Vic Roy also had, I think he was the one that, or someone else had the article about pharmaceutical companies. They used to be in Puerto Rico, and then they, through different things, right, they ended up in China. So we have a lot of limitations that the president was mentioning. We need to make sure we're self-sufficient and self-reliant here, and so this is showcase some of those principles.
Leo, where can people follow you?
So we're on obviously on Twitter, Dr. Leo Valentin. We're on Facebook, and our website is leovalentin.com. So we're trying to be very active on social media. So feel free to reach out, and we're going to be doing more events as we go along.
Great. It's been very instructive. Thank you for joining us.
No, thank you. My pleasure. And I just wanted to thank you for having me here, and thank my brother, Giancarlo Valentin, who actually introduced me to you guys. So he was the first one to recommend I should be listening to you more.
Great.
Very good. Best wishes.
Thank you.
Alrighty.